The report's authors are calling for a two-thirds reduction in the number of antipsychotic prescriptions for dementia within 3 years. While more resources will likely be needed, firms like Barchester Healthcare, which runs Dereham House in Upminster, Essex, say they've reduced their use of antipsychotic drugs by 80% in some homes as a result of basic good practice. Of the 32 residents in this care home with dementia, only 6 of them are on antipsychotic drugs. The managers here believe that simple attention to people's daily care can often take care of many of the difficult behaviours that are attributed to dementia and treated with antipsychotic drugs.
We do life histories. We try to find out as much as we can about the person, because people can reenact jobs, people believe they're still going to work, and that's why they need to get out, because they need to go to work, they're going to be late, or they need to pick the children up from school. So it's having an understanding of their life, and then the way they are approached is to assist them to solve the problem that they've got, and you can solve most problems without resorting to antipsychotic medication.
The Department of Health has said it will accept all of the recommendations of the report and will improve specialist dementia care in care homes and the community. Advice will also be given to people caring for dementia sufferers on the drugs at home. But for now, they're warned not to stop drug treatment without medical advice.
Tom Clark reporting. We're joined now from Birmingham by Professor Steve Field from the Royal College of General Practitioners. One of the charities involved, Action on Elderly Abuse, say they're going to bring legal action against some GPs.
Yes, I mean, it's very easy to blame either care homes or GPs. I mean, frankly, the problem is that if they have good care, like obviously the Barchester homes provide, and my own practice work with Barchester in one of their homes, they have a high quality of internal training for staff. If the staff can cope with agitated patients, you don't need to do anything, actually.
Good afternoon and welcome to the BBC News at 1. 1,800 people who suffer from dementia are dying every year because they've been given powerful antipsychotic drugs they don't need. A report for the government says almost 150,000 people in England are prescribed the medicines when they shouldn't be. Antipsychotic drugs are normally used to treat people with schizophrenia, but in some care homes and hospitals they are also used to treat dementia patients. Our health correspondent Jane Hughes reports.
Dementia is the most debilitating condition. It can make people aggressive, agitated, prone to wandering. Doctors often respond by giving them heavily sedating drugs, drugs that have become known as the chemical kosh. Today's report underlines just how much harm antipsychotic drugs can cause. About 700,000 people in the UK have dementia now. It'll be double that in 30 years. Nearly 150,000 are getting antipsychotics unnecessarily. They can cause severe side effects and an estimated 1,800 deaths a year.
Using antipsychotic drugs can seem like a simple solution if a resident becomes agitated or even aggressive. But quite apart from the side effects, research shows that they simply don't work that well in the long term, and that if a resident's looked after properly, it's usually not necessary to use what's known as the chemical kosh.
This is the kind of activity the report recommends. At Hilton Park Care Home in Cambridge, they've cut right back on the use of antipsychotics and instead make sure staff are trained to engage with residents and help them stay active.
Because they're not sedated, they eat better, they drink better, which all helps with well-being. They enjoy joining in things.
And so would your dress have flowing skirts? Or?
But care like this doesn't come cheap, and though the government's promised action, some are asking whether the resources are there. Resources to establish a better way of caring for the hundreds of thousands of us who will be affected by dementia.
Good evening and welcome to the BBC's News at 6. A hard-hitting report has accused doctors treating patients with dementia of prescribing antipsychotic drugs far too often. Good evening. 1,800 dementia patients die every year because they've been treated with unsuitable antipsychotic drugs.